Hey there, and welcome to Kernel of Wisdom. I'm registered psychotherapist Joelle Anderson, and today I'm talking about trauma. I know, trauma is a term that we hear thrown around a little bit, but what does it actually mean? Let's start by defining it, which honestly, even on its own, is not that simple a task. According to Ford and Courtois, as well as many others in the psychological field, there are two broad categories of stressors that can cause trauma. One type is when people experience a significant but isolated event. And that kind of event would generally impose significant risk or actuality of death or really bad harm to one's person, or it causes fundamental and life-altering psychological harm. And the other type of event, or I should say events, are not generally isolated events. They're described as repetitive, prolonged, pervasive, and in some cases, ongoing events. The second type of trauma is generally considered more complex, and examples generally involve: 1, interpersonal events, especially if they involve some sort of relational betrayal. 2, especially in the case of children, there's some form of direct attack, harm, neglect, abandonment by caregivers or other adults or institutions that were otherwise in charge of caring for them. This includes disbelieving someone about their trauma. And 3, overwhelming amounts of stress, especially at developmentally relevant times. So to sum it up, there can be more acute, isolated incidents that cause trauma, or more pervasive, prolonged, and chronic events that cause trauma. It's a little more complex that way. So how do we sum all of this up? Well, many clinicians, myself included, would suggest that a traumatic event becomes traumatic when it occurs at a time or in a way that overwhelms the resources available to that individual. In other words, if an event overwhelms you at that stage of your life, it might cause trauma. To break down a few key points in this, it doesn't just add stress or pressure. It's not just challenging. It's literally just an event that's too much for where that person's at. Either because they don't have enough resources, they're too young to realistically have sufficient resources, or because they're so stressed in general that that one more thing completely overwhelms their system. This changes the idea of threat of death, because it's not just the threat of real physical death or real physical harm, it's also the threat of what's called ego death, or a sense of completely losing ourselves. It's like one's integral wholeness is jeopardized. And 3, it's about the event overwhelming that person's resources at that time, which implies a few things. Just because you could handle it with where you're at today doesn't mean that you were able to handle it with where you were at the time of the trauma. There could be other stressors involved, or you might have been too young at the time to realistically cope with that thing. Even if you can rationalize or understand something now, doesn't mean that it didn't leave trauma then. And sometimes that's exactly why it's not enough to try and rationalize yourself out of it now. It's the body that remembers the trauma from the time and in the way it happened then. It also implies that it doesn't matter how other people interpret the event. It matters how the person with the trauma experienced the event. And on that note, I will be doing a series of videos about trauma specifically, including videos about how trauma is stored in the brain and its implications on the brain, as well as how that can manifest in symptoms, in ways that trauma is treated. If you or anyone you know thinks that you are dealing with trauma or trauma symptoms, please reach out to a mental health professional near you. And a reminder that if you or someone close to you is in a state of emergency, to go to the nearest hospital or call your local emergency line. Otherwise, thanks for watching. Please subscribe for more content or like this video so others get to see it too. Be well and take care. Bye.